Moi? Cut Medicaid? I don't know what you're talking about. We're not cutting Medicaid. We're going after waste, fraud, and abuse. That's pretty much been the refrain of President Trump and the Republicans since they started with their big, barbaric, bait and switch bill. But now we see that that's exactly what they're doing. $930 billion, almost $1 trillion in Medicaid cuts, right in black and white for everyone to see. But for sake of argument, let's play their game. Let's look at the waste, fraud, and abuse in the Medicaid system. The Department of Justice and the Department of Health and Human Services have a joint effort known as the Medicaid Fraud Takedown Team. And each year they publish a report listing the cases that they brought against Medicaid fraud defendants. These licensed medical professionals were defrauding taxpayers to the tune of almost $15 billion for many, many years. And, this joint team caught it and they brought them to justice and they recovered much of that taxpayer money for the American people. They utilize agents from federal agencies like the FBI, the DEA, and the Health and Human Services Office of Inspector General, along with 50 federal districts of law enforcement and 12 state attorneys general's offices. Medicaid fraud, according to the Department of Justice, what they consider to be Medicaid fraud is when a provider submits a claim for services they didn't perform. It's not when an individual who needs health care puts in an application and receives Medicaid health care that they're not eligible to. However, the Health and Human Services Office of Inspector General does publish an annual summary each year on the cases that it brings by the state Medicaid Fraud Control Unit. These investigations find a negligible amount of beneficiary fraud. So fraud where somebody submits an application and just gets free health care for a year. It's 2% of all cases. So 98% are medical care providers submitting claims that for services they didn't render. Only 2% are the type of waste, fraud, and abuse that Donald Trump and the Republicans have been talking about, 2%. So now it's time for us to ask ourselves why these politicians and members of the media are focusing so hard on this 2% of beneficiary fraud and not at all on the 98% committed by providers. When Pam Bondi and HHS Secretary RFK Jr. issued statements about the 324 defendants they didn't differentiate. They just called it Medicaid fraud. They didn't detail the fact that these were medical health providers, not people defrauding the system. So who benefits if the American people believe this narrative? Why do the media and the politicians focus so much on a few individuals who might be getting a few $1,000s of free health care that they probably desperately need? And they probably just, barely are not eligible because they make a little bit too much money. They're not so far into poverty that they, are eligible for free health care, but they desperately need it. And they definitely can't afford to pay for it on their own. But yet we're so focused on them. Meanwhile, these medical professionals are getting away with millions and billions of dollars. And why aren't we focusing on them? Why do we care about a few people a year who might be getting some free health care? It doesn't make sense, right? Well, that's until you factor in the fact that they use this misinformed narrative to excuse the fact that they are cutting nearly $1 trillion in Medicaid, in people's health care, in children's health care from the budget. And they are having to do this because it's the only way that they can get the budget passed with all their tax cuts for the wealthy. They have to cut so much from the budget in order for that bill to make it past the House and the Senate by law, because there's laws about how much they are allowed to add to the debt over a 10-year period. So they need that $1 trillion in people losing their health care in order to get their tax cuts for the rich. Now, tied into that $930 billion are work requirements, right? They said we're just putting on work requirements. Well, that's not true. But let's say it is. Let's say all $930 billion that'll be cut is because people aren't working and they're just living off of the state and soaking up free health care. Well, when we actually look at the statistics, we find that 70% of adult Medicaid beneficiaries are working. And the ones who aren't are either disabled and can't work, or they're taking care of a loved one who is disabled or is a dependent child. So if that's the case, then how are they expecting to get all these cuts and savings, right? If everybody's working, so they're eligible for the health care that they're getting, right? Or they're disabled, which means they're not required to work under this bill. Well, history has shown that whenever states implement work requirements for health care, they end up cutting, millions of people off the healthcare rolls accidentally because of errors in paperwork, of missed deadlines for reporting, or like just missing information. So I'm sure you're starting to get it now. That way they can say they're not actually cutting Medicaid, but they can cut Medicaid. at the same time, right? Without having to take responsibility for actually cutting it. But as I just told you, if they didn't really believe that the cuts were coming, and if the Congressional Budget Office didn't estimate that 12 million people are going to lose their health insurance because of these work requirements, they wouldn't be able to get their tax cuts for the rich passed because the cost would exceed the amount that they are allowed to increase the debt by within a 10-year period. A rather large part of these cuts is going to be from the Affordable Care Act Medicaid expansion, which a lot of people don't even realize they have. So the ACA Medicaid expansion said that if states put up 10% per beneficiary, the federal government would put up 90% per beneficiary to give people health insurance. Now, a lot of these people, these are working people. Some of them pay a premium, some of them pay co-pays. Depends on you pay what you can afford, pretty much, with these state healthcare plans. These plans include Medi-Cal, New York Health Plan, Sunshine Health, CHIP, right? It's your state healthcare insurance program, but it's funded by federal Medicaid expansion through the Affordable Care Act. The way they're going to cut that is that most states use a provider tax. They charge providers 6% for accepting Medicaid because they're, getting paid through Medicaid. They are making money off of Medicaid beneficiaries by providing services to them. So it costs them a 6% tax on those services. And then states use that tax to cover their 10%. So you see, they want to cut their ability to charge that 6%, cut it down to 3%, and make sure it does not increase with inflation, so that eventually people will get thrown off the rolls because the states will no longer be able to cover their 10%. And I'll let you in on a little secret, something that a lot of people are missing, something even the media is pretty much missing, either because they are willfully ignorant or they are just ignorant. All these cuts coming down the pike, right? The $1 trillion in Medicaid cuts, the billions of dollars in SNAP benefits, they are not going to take effect until 2029. Yes, you heard me right. They will not take effect until 2029 when Donald Trump is no longer in office. What they expect is that Donald Trump is not going to be in office, and neither are Republicans. They expect that a Democrat will be in office by that time, and that Democrat will be able to take all the heat when people start getting thrown off their health care. And when people start getting thrown off their SNAP benefits, they won't be able to feed their families. They won't be able to take their kids to the doctor. And they're going to blame a brand new Democratic administration who just so happened to come in at the same time that they started losing benefits. Meanwhile, they'll already have counted and bought back their stock and bought new yachts with all their top, 1% tax cuts that they already got, because those things take effect immediately. So there you have it, folks. That's the bait and switch. That's the scam. Those are the things that they're trying to hide from you. They are going to make it so that people lose their health care, but they are also going to make it so that it's far enough away from the passage of this bill that people don't connect it with the actions that are being taken right now.